Dr. Purcell, as we wind this podcast up in the last couple minutes, what would you like to tell employers about why they should use a DPC doctor? What's the best way for them to feel comfortable doing that, getting out of the bukas, we call it?
I would say, there's several different ways you can search for direct primary care clinics in your area. There's a website called dpcfrontier.com, dpcfrontier.com, and it has a map there because you can see who's doing direct care in your area, which is helpful. You can contact them and say, hey, let's talk about this. Our DPC Alliance that I'm a part of, dpcalliance.org, we have a strong list of independent direct primary care physicians across the country that you can connect with and, team up, meet up, and see how you can, help each other. Those are big things. I think being a part of larger organizations like Free Market Medical Association can be helpful, where you can meet other advisors, benefits advisors, brokers, other employers that join up. Going to some of those conferences can really be helpful. And then really trying to find, this is tricky, but trying to find that benefits advisor that understands where you're coming from. If you're a DPC physician, trying to reach out in your area to look at, who's doing real hardcore financial savings for employers in the benefits advisor arena, because most of them are just looking for their commission, they're looking for their bonuses, and they're not doing the hard work. And I'm sure Matt would agree with this. This is not easy. It's hard work to save that money, but it's worth doing. And I think from an employer standpoint, I think whoever's in charge of the healthcare system it should be a CEO level position. It should be, you're the chief medical officer for your company, and that does the CEO level work. And it's that critical especially for a larger employer. If you got 500,000 employees, you're talking about massive amount of money. And you'll have a CEO who's responsible for everyone, but somebody needs to be responsible for that financial responsibility of healthcare. And it doesn't need to be the CFO. It needs to be somebody else. Because many times it's just the HR person. We don't have HR people like Matt that really care about
Right.
it. They're more like, hey, you know what? I don't want to deal with this. I just want to sign this paper. Let's renew. Let's go and get this thing done, because it's such hard work. So it takes courage. I would reach out, if you're an employer, reach out to DPC. Look for those DPC doctors in your community and get to know them and try to see if that's a deal and a way to work together.